So the next thing I wanted to talk to you about was good old-fashioned vitamin C. People often underestimate the power of vitamin C. So human beings don't make their own vitamin C. They lost their ability to make vitamin C a long time ago. Now lots of other animals make vitamin C. For example, dogs make a tremendous amount of vitamin C. There's probably something about 8,000 milligrams a day they make in their liver. Goats, I believe, make about 18,000 milligrams per day in their liver. And human beings, we don't make vitamin C anymore, so we have to rely on that from our food or supplementation. The problem with the food is that the soil has been over-farmed, so the nutrients aren't there anymore and people aren't putting back nutrients into the soil. So a lot of the fruit that we eat, even if it's organic, and organic is fantastic because of the pesticide problem, but still there may not be sufficient amount of nutrients in the fruits, vegetables and the other foods that we eat. So supplementation is very important, especially if you're sick. Now, the really amazing thing about vitamin C is that it's dependent on the body's need. If you took very high doses of vitamin C in a healthy individual, then that may cause diarrhea. Now, if you're sick and you need vitamin C, your body can tolerate a lot more vitamin C than it could if you were healthy without getting diarrhea. A lot of you wanted me to talk a little bit about the Ebola virus. So in terms of vitamin C and animals that make vitamin C, it's very interesting that animals that actually make vitamin C in their bodies do not usually catch or die from Ebola. Other animals, apart from humans, that don't make vitamin C are monkeys, guinea pigs, and bats. Now, it's very interesting that the bat is thought to be the reservoir for Ebola, and it's one of the animals that doesn't make vitamin C, so it's interesting to see that connection there. This brings me to Robert F. Cathcart, who was an orthopedic surgeon who successfully treated over 20,000 patients with very high doses of vitamin C, sometimes over 150,000 milligrams per day. He also used intravenous vitamin C as well as supplementation. His work showed that these type of diseases kill the host by hemorrhage, which is a type of severe scurvy effect where the body breaks down and hemorrhages, so you bleed inside the body. That's what kills you. He found that very high doses of vitamin C, which have an antioxidant cell protective effect, will prevent this damage to the body. Now, I wanted to tell you about a famous case. It's probably the most famous case in medical history in New Zealand. It was about a man who developed severe swine flu. His wife woke up during the night, she was sleeping next to him, and found that he was burning up. Now, she gave him some Panadol, which brought the fever down. And then she woke up again and felt him, and he was stone cold. She thought he was dead. They rushed him into hospital, and they found that he had a really bad case of the swine flu, and very quickly he deteriorated. They had to bring in a special respirator to keep him alive because his lungs were completely full of fluid. It's called whiteout pneumonia, and his lungs weren't working on their own. This man was deteriorating rapidly in the hospital. His condition was getting worse and worse. There was nothing they could do for him. They brought in the family and they said, look, we advise that you turn off the machine and let him pass away. His family were determined not to let him die. So they did some research and they came back and spoke to the doctors. They said, look, let's try vitamin C. We've looked at some research on vitamin C intravenously in very high doses. Let's try that and see what happens. And the doctors were saying, no, there's nothing that we can do, the vitamin C is not going to work. The family were arguing with them for quite a while. They had a meeting with all of the doctors. There was only one doctor that said, actually, let's not turn off the machine, let's see what happens. So they finally agreed to try very high doses of vitamin C intravenously. Now, within 2 days, the patient started to improve. The fluid started to drain from his lungs and he started to improve quite quickly. And the doctor said, no, it's impossible, it's not the vitamin C. It must be some other reason. It must be because at the time we administered the vitamin C, we moved the patient on the side and that's why the fluid was draining. So they carried on with the vitamin C for a while, and the patient improved so much that he was actually conscious and out of his bed now and sitting in a chair. Then a new consultant had taken over, and he said they're going to stop the vitamin C. And when they did, the patient started to deteriorate quite quickly again. They were arguing. The doctors again went on and on, and they actually had to go to court. But they finally were able to give him vitamin C again, which produced tremendous, amazing results. When the patient was very sick in hospital, they also diagnosed him with leukemia as well. When the patient had recovered, there was no sign of leukemia either. And they actually told the patient he would need about 6 months of physiotherapy, but he was so strong after the vitamin C that he actually walked out of the hospital and just went home when they discharged him. Now this is the most amazing case in medical history in New Zealand, and it baffles doctors to this day. They simply don't use vitamin C as a form of treatment.